Hello, I'm Dr. Courtney Barnes. I want to welcome you to the University of Missouri Women's and Children's Hospital. I want to tell you about some exciting things that we've been working on since 2009. We decided we would look at every aspect of our patients' care and figure out a way to do it better. So we want to tell you about some of those changes we've made, and we hope you have a really great experience here.
Okay, here's your beautiful baby boy. We're gonna put him up here, dry and stimulate him, and cut his cord, clamp it off. Drying and stimulating, baby looks good, it's nice and pink. Beautiful cry. Let's get this baby in here skin to skin with mom. So putting baby skin to skin helps keep baby's temperature regulated, stabilize the blood sugars, also helps bonding with you and your baby, and will help let you have a successful breastfeeding experience. So
Right now, we're in our newborn observation unit where you can see there are no babies. And you might ask yourself, why? Well, at the University of Missouri, we actually keep our moms and babies together during their entire hospital stay. We call this rooming in. Rooming in is really important for you and your baby. The babies that are in the nursery tend to cry more, they don't get fed as often. So babies that stay in the room actually lose less weight. They get to know their moms better, and it's really great for bonding. We think you're really going to like keeping your baby with you while you're in the hospital.
when should you feed your baby?
We want you to feed your baby whenever your baby shows signs of being hungry. So there are some early signs for when your baby's hungry, some middle signs, and some super hungry signs. If you wait till your baby is super hungry, it's really hard to get your baby to eat. So we want you to feed your baby early on whenever your baby shows signs of hunger. Let's talk about some of those feeding cues.
Hi, I'm Stephanie. I'm a tech on labor and delivery.
And I'm Roxanne. I'm RN on labor and delivery.
We're going to talk about feeding cues.
And the first ones are going to be first feeding cues. Now we'll do middle feeding cues. Now this is when we're really hungry.
We want you to feed your baby whenever your baby seems hungry. You cannot overfeed your baby. You just want to feed basically every time you see a hunger cue, offer to nurse your baby. Some of those times are going to be really close together, and some of those times are going to be further apart. Just remember, 8 or more in 24.
Eight or more in 24.
8 or more in 24.
8 or more in 24.
We want to talk to you just a little bit about why it's important that you have a good latch when you're breastfeeding. It's really important so that you don't have sore nipples. If a baby is latched on improperly, sometimes women will develop blisters or have even some breakdown in the skin, and that can be a reason that women stop breastfeeding. Another important thing is if you have a good latch, milk will transfer from your breast to the baby very efficiently so that your baby gains weight appropriately, is getting the right amount of nutrition, and also so that you develop a really great milk supply. I want to introduce Carrie Custer. She is one of our inpatient lactation consultants and also a staff nurse on the postpartum unit. She's just going to give a couple tips on how to get a good latch.
Hi. First thing you want to do is make sure that both you and baby are comfortable. If both of you are comfortable, it's going to be easier for you to maintain a good latch along with your good supply. Biggest thing for moms to remember is very simple, is lipstick versus chapstick. When baby unattaches from the breast, just look down at your breast, look at the nipple, and make sure that your breast or your nipple is round, kind of flat, but that it looks like a brand new chapstick. If it looks slanted like a brand new lipstick, then baby has done something wrong during the course of the latch, most likely sucking that underlip under, like that, and something that you need to work on with your next latch.
And here at the University of Missouri, all of our nurses are breastfeeding educators, and we have a large number of lactation consultants that will help you if your nipple looks like a lipstick and not a chapstick. I want to introduce Kelly Shellman. She's our full-time inpatient lactation consultant, and if you are breastfeeding, she'll be the one that helps you in the hospital to make sure that everything is going well. One thing that I want Kelly to talk to you about today is if you're breastfeeding, the importance of avoiding any sort of supplementation with either sugar water, or formula. Can you tell us a little bit about why that's important?
It's very important when you're breastfeeding to not introduce any formula, just because it can increase the risk of infant diarrheal disease, childhood obesity, and also allergies in the infant. And it's really important for your milk supply. Anytime you introduce any nutritions besides your breast milk, it just tells your body not to make as much milk and can decrease your milk supply.
Right, that's really important. So one thing is when you're in the hospital, we try very hard to not supplement if at all possible. If for some reason there's a medical reason for supplementation, your child care team will talk to you about that, and we have ways of supplementing for medical reasons without harming your breastfeeding success. And we're very excited to help you so that you can be successful with breastfeeding. Thank you so much for taking time to watch our educational video. We hope you learned a lot about what we have to offer here at the University of Missouri, and we hope you have a really great experience.